You smoke every day like a hero, for style, for attitude. But have you ever seen how your healthy lungs work for you? Let's begin with a healthy human lung. We have two lungs, the right lung and the left lung, soft, spongy organs responsible for breathing and oxygen exchange. The right lung is slightly larger and divided into three lobes. The left lung is smaller, making space for the heart, and has two lobes. This is the right superior lobe, the upper portion of the right lung actively involved in oxygen exchange. The pleura is a thin, double-layered membrane that surrounds the lungs and reduces friction during breathing. The right middle lobe helps increase lung surface area and supports efficient respiration. This is the left superior lobe, performing the same vital gas exchange function on the left side. The left inferior lobe is a major oxygen exchange zone, especially active during deep breathing. The trachea, or windpipe, carries air from the throat down into the lungs. The right main bronchus directs air into the right lung. The hilum is the gateway where bronchi, blood vessels, and nerves enter the lung. The left main bronchus carries air into the left lung. Lobar bronchi distribute air to each lung lobe. Segmental bronchi supply specific lung segments. Bronchioles are tiny airways that regulate airflow and lead air toward the gas exchange areas. Internal intercostal muscles help with forced breathing out, pulling the ribs downward. External intercostals lift the ribs upward during inhalation. The sternum is the central chest bone that protects the heart and lungs. The rib cage protects thoracic organs and expands during breathing. Transversus thoracis assists in stabilizing the chest wall during respiration. The superior vena cava brings deoxygenated blood from the upper body to the heart. The aorta carries oxygen-rich blood from the heart to the body. The pulmonary trunk carries deoxygenated blood from the heart to the lungs. Pulmonary arteries deliver blood to the lungs for oxygenation. Pulmonary veins return oxygen-rich blood to the heart. The inferior vena cava carries deoxygenated blood from the lower body back to the heart. The vagus nerve controls airway tone and heart rate through the parasympathetic system. The pulmonary plexus regulates bronchial muscle movement and airway secretions. The cardiac plexus controls heart rhythm and strength of contraction. The phrenic nerve controls the diaphragm, the most important muscle for breathing. This is how healthy lungs work together to keep us breathing. Now on the screen, you can see what happens inside a smoker's lungs. The black patches you're seeing are toxic pollutants from cigarette smoke sticking to lung tissue. Over time, this damage makes breathing harder and weaker. This is why smoking harms your lungs. So quit smoking before your lungs quit on you. If you like this video, please like, share, comment, and subscribe the channel.